Welcome to the EdFaith Essentials podcast. EdFaith Essentials is an educational podcast that provides essential information, resources, and tips about education, leadership, and topics about diverse learners. Diverse learners include students with disabilities who receive services under Section 504 or the Individuals with Disabilities Education Act, response to intervention and the multi-tiered system of support, English speakers of other languages, and related diverse learner categories. EdFaith Essentials' mission is to bring positive awareness and promote equity and inclusion in education by sharing information and topics about non-traditional learners. EdFaith Essentials' goal is to restore faith in education one student at a time by empowering listeners with knowledge, because we all know that knowledge is power, so let's be powerful. I am your host, Dr. Nakia, sending you good vibes and thanking you for joining me for another episode of the EdFaith Essentials podcast. Let's go ahead and start with our EdFaith inspirational story. Each year, the Council for Exceptional Children celebrates the remarkable achievements of children and youth with exceptionalities who have shown extraordinary determination and resilience in various areas of life. The Yes, I Can Awards are presented at the CEC Convention and Expo, and it honors 12 exceptional students who have demonstrated excellence in 6 categories: academics, arts, school and community activities, self-advocacy, technology, and transition. These inspiring individuals inspire us all to strive for greatness and overcome any obstacle that comes our way. I want to congratulate the 2024 CEC Yes, I Can recipients for this year. For academics, we have Helena Donato Sapp and Willow Townsend. For arts, we have Korik Biswas and Zachary Laviola. For community and school activities, we have Noah Livers and Mary Ugbo. For self-advocacy, we have Georgia Carruthers and Owen Delate. For technology, we have Rosa Maria Romo and Kyron Johnson. And for transition, we have Rebecca Robertson and Liana Torres. Congratulations to all of you young people who are doing exceptional things, and you are the Yes, I Can 2024 award winners. If you want to nominate a student or learn more about those award winners, I will have that information and that link on the EdFaith Essentials YouTube page. I want to provide a heartfelt congratulations to all the award recipients. Thank you to the CEC for your unwavering commitment in recognizing and celebrating these exceptional individuals. And that will do it for our EdFaith inspirational story. Now let's shift to June. June marks the beginning of summer, vacation time for everyone, and just a great time to just relax and rewind, especially if you are an educator. If you're a parents, you are going out on vacations and you're spending that quality time with your children. And if you're a leader, you're winding down or getting ready to close out a school year. Here are some dates to remember for the month of June. June is National Safety Month, Alzheimer's and Brain Awareness Month, Pride Month, National Dairy Month, PTSD Awareness Month, Migraine and Headache Awareness Month. June 14th is Flag Day. June 16th is Father's Day. Happy Father's Day to all the fathers out there. And June 19th is Juneteenth. And then on June 30th, that is the online FAFSA application deadline. If you have a student that is in college or going to college, you want to make sure that you have that financial aid application completed and submitted by June 30th. And that will be it for our dates to remember for the month of June. Now it's time for some essential news. Story 1. In recognizing May as Mental Health Month, the Office of Special Education Programs, OSEF, offers support to states and school districts to encourage and implement the integration of mental health supports in schools. Centers like the Center on Positive Behavior Intervention and Supports and the National Center for Pyramid Model Innovations are available to support students with disabilities. Integrating mental health services into individualized education plans, IEPs, offers a multifaceted approach to help from social skills to stress management to coping mechanisms. Such supports can assist a student holistically when you're looking at services for students who have IEPs. And that information and link will be on the EduFaith Essentials YouTube page. Story 2. The National Center on Deaf Blindness released Spanish versions of 2 well-known publications for intervener services. Are intervener services appropriate for your student who is deaf and blind? An IEP team discussion guide and tools to employ and support interveners. The first publication aims to assist IEP teams in making informed decisions about whether or not intervener services are appropriate for a student who is deaf and blind. It guides how a student's deaf blindness can impact access to information, communication, social relationships, and conceptual learning. The second publication, Tools to Employ and Support Interveners, offers detailed information about the roles and responsibilities of interveners and how to navigate the employment process and obtain training and certification. Once again, the title of those 2 resources are Intervener Services Appropriate for Your Student Who is Deaf and Blind, an IEP team discussion guide. And then the second one is once again titled Tools to Employ and Support Interveners. Story 3 is about an accommodations toolkit. The National Center on Educational Outcome, NCEO, has released an updated accommodations toolkit. The toolkit provides easy to understand summaries and academic research literature on specific accommodations for students with disabilities and policy analysis. The toolkit presents information on various accommodations such as tactile accommodations, graphics, braille, test breaks, extended time, and other accommodations to individual research fact sheets. Story 4 is coming from the Office of Special Education Programs newsletter, and this story is all about the basics of accommodation and modification toolkit. The purpose of this toolkit is to support educators and districts with clarity on accommodations and modifications for students with disabilities. To address this and help support educators, the brief is named The Basics of Accommodations and Modifications, and it is now available to help support districts, schools, and staff to help support and provide clarity on accommodations and modifications for students with disabilities. Our final story for today, Story 5, is coming from the Office of Special Education Programs, the May newsletter, and thanks to OSEP funding, there are now American Sign Language versions of popular PBS cartoons like Daniel Tiger and Arthur available for our listeners and viewers. Check those episodes out. They are available at pbskids.org, and you can go and click the link and you can view episodes in American Sign Language for those cartoons on PBS. This link and all of the links that we've discussed today with all of the stories came from the Office of Special Education May newsletter with OSEP Director Valerie C. Williams. Thank you for the resources. So just to recap all of our essential news and announcements, Story 1, focus on May Mental Health Month. Story 2, the National Center on Deaf Blindness with those resources and IEP guides. Story 3 was the accommodation toolkit. Story 4 was the basis of accommodations and modifications, additional resources to help support educators and leaders in schools. And then Story 5 was the story about the PBS Kids and the American Sign Language episodes. I want to encourage you to go to www.edufaith Consulting and subscribe to my website and become a part of the EduFaith community. And then also go to the EduFaith Essentials YouTube page and subscribe so you can get all of the announcements and information. And that will be it for our essential news. Now it's time for essential knowledge. May was Mental Health Awareness Month, and I wanted to take some time on this episode to discuss some topics that are really prevalent in our society today related to mental health. With the prevalence and impact of mental health on students, parents, educators, and leaders, I thought it was time to educate each other, raise awareness, and have a discussion and provide some tips for listeners about depression, suicide, and stress. For this episode, we have a special guest. Dr. Melissa Marsh is an administrator in a Metro Atlanta district. She coordinates the development and supervision of school counseling, student advisement, crisis response, and hospital homebound programs. She has 20 years of experience filling the roles of Georgia State High School Counselor, Supervisor of Counseling, and School Counseling and Advisement Consultant. Melissa received her PhD in Counseling Education and Personnel Services and Specialist degree in School Counseling from the University of Georgia. She received her Advanced Master's in School Counseling from the University of North Carolina at Chapel Hill. Dr. Marsh has also authored 3 books. In the 15-minute focus series, suicide prevention, intervention, and postvention, and depression signs and strategies for counselors, educators, and parents, along with her latest workbook titled Stress and Burnout in Education. Missy lives in the Atlanta metro area with her husband and puppies. In her spare time, she enjoys traveling, yoga, cycling, running, hiking, and spending as much time outdoors as possible. I would like to introduce my special guest and friend, Dr. Melissa Marsh, to the Edge of Faith Essentials podcast.
Hi, Dr. Cotton. Thank you so much for having me today.
Thank you for being here. I am so excited to have you here. I can feel your energy through the podcast.
I'm excited to be here with you.
All right. Well, let's go ahead and get started because I feel like we have a couple of important topics to discuss because mental health matters and we have to have the conversations whether we want to or not. And I want to talk about all three of your books. The first book we're going to talk about is 15-Minute Focus, Suicide Prevention, Intervention, and Postvention. The first question I have for you is, what inspired you to write your book on suicide prevention, intervention, and postvention?
Well, thank you again for having me. The topic of suicide is more relevant than sometimes people realize. So suicide is the second leading cause of death for ages 10 through 24. So when we think about 10-year-olds, they are fifth graders. And that in itself is terrifying when you think about it. So we have fifth graders who are dying because of suicide. And I know that a lot of people don't want to talk about suicide. There's definitely a stigma that is still attached to it. But when you think about such young children who are thinking about suicide, dying because of suicide, it's critical. That suicide prevention piece that when I travel around the nation, I see is missing. So my personal story as it relates to suicide and really what inspired this book is when I was a counselor in a high school, we unfortunately had a number of deaths by suicide. And for anybody who's experienced a suicide, you know the impact that it has, not just on the students and not just on the staff, but on the entire community. And if you can imagine what one suicide, the impact that it has, then think about what a second suicide might do, or a third, or a fourth. So my worst year ever of school counseling, we had 4 students die by suicide in a single year. And very honestly, Dr. Cotton, our school was not doing prevention, suicide prevention, the way that you're supposed to be doing suicide prevention. And luckily, with the help of colleagues, we were able to write a grant to get suicide prevention added for the subsequent years, but it was too late. If you lose one student, it's too late. And so the following year, we were able to implement suicide prevention for our students, for our staff, for our families. And from that point moving forward, as long as I was there in that school and in that community, we didn't have another death by suicide. But again, at what cost?
Wow.
So
that is really impactful and just powerful information. And it's also really sad and transparent. And
thank you.
That is a great, reason and rationale. And 4 lives is too many, especially for our young people. Thank you for sharing, and thank you for the inspiration and the grant and the work that you've done to help support this topic. As we shift to the next question, I wanted to ask, can you share critical strategies or insights from your book that individuals and communities, because you mentioned communities, can use to prevent, or, I don't even know if we can say prevent, but address suicide?
The number one thing that I would stress to schools, to families, to communities is to be very proactive with prevention. As I mentioned, even in my own story, that lack of prevention was so critical. And I see this across the nation, when I go and work with schools and work with communities and do speaking engagements on this topic, that people are afraid to speak about suicide. They're afraid to do classroom lessons or to do events to train parents or families or staff or students about the risks and the warning signs of suicide. And yet the research shows that an ounce of prevention is worth so much more than anything else we could do.
I agree. It is an uncomfortable topic, but it's very prevalent, and it is something that needs to be brought to the forefront, and communities should have these conversations. So I'm glad to hear that, being proactive is the key to support prevention.
It is. And I tell my groups when I'm doing trainings, right? I know it's a heavy topic, but every time that I do a training, I'm so hopeful, right? Because now there's another group that's trained that's going to go out and it's going to save lives. And so I get chills even just thinking about it, because that means that there's that many more people who are focused on suicide prevention, that know tips and techniques and are able to go out and make our community or our world a suicide safer place.
Wonderful. Wonderful. And you mentioned just a little bit when you answered the last question, but in your experience, what are some common misconceptions about suicide, and how does your book address or correct them?
So there are a lot of myths still as it relates to suicide. As I mentioned, there is still such a stigma, and people are afraid to do the work. Some people are even afraid to use the word suicide. One of the biggest ones that I hear from individuals is that if you talk about suicide, then you're going to implant that idea into a person's mind. And research shows that that is not the case at all. And that's one of the things that we sort of dispel, is that actually by asking directly if an individual is thinking about suicide, you're showing that you're comfortable with the topic, that you're a trusted adult, that they know if they are talking about suicide, they can continue to have the conversation with you. But if they are not thinking about suicide, you're still a trusted person for anything that might come up in the future.
Trusted person, that's another word. I'm taking notes as we talk. So that's another word, comfort, a trusted person. So those are some things that just standing out as we think about this for parents and for our educators and our leaders.
Absolutely. And it's, one of the things that we really try to work with our students on in some of those preventative measures, but also in those moments where we have to intervene. Who are those trusted adults, right? And if you can think about them in times when you're not in crisis, it's much easier to come up with them when you are in crisis. So knowing whether it's people in your school, people in your community, whether it's your parents, who are those trusted adults that you could go to if you were in a crisis or having these thoughts of suicide.
Awesome. And then speaking of trusted adults and what we're talking about as far as those people who can help support, what role do you see mental health professionals playing in suicide prevention efforts? And how can they utilize resources and knowledge outlined in your book to help support their clients better?
There are great opportunities for school counselors, social workers, school psychologists, support staff, just anyone to really work with students with suicide prevention, intervention, and postvention. And the first step is really just knowing the basics of how to talk about suicide, which we go through in the book. Just some clear steps for how to talk about suicide, which is, as I said, still very uncomfortable, even for many professionals, right? Considering and implementing those various prevention programs. What are some of those programs, perhaps, that school personnel could consider for their school or for their district? How to improve possibly current intervention programs, because most schools or districts do actually have an intervention program, which is wonderful. And of course, then supporting that post-vention as well. So the book talks about all of those and the steps that are needed for it.
Awesome. Some great strategies. And it sounds like the book is, a resource for not only counselors in the school setting, but also therapists, educators, anyone, even parents. So it sounds like
Absolutely.
It's a resource that's global to help support anyone in any position.
That's the hope, right? Just
Yes.
what is needed to know so that we can keep, again, students, but also adults safe. Just loved ones safe.
Which leads to the next question. How can friends and family members best support someone who may be struggling with suicidal thoughts or behaviors as discussed in your book, as we talk about your book being a resource?
Yeah, the first step, and it's going to sound simple, but I know that it is challenging, is simply to recognize the signs of suicide, being aware of what those might look like in a loved one, and then to acknowledge them with that individual. And that can be really scary to do. But saying to that loved one that I care about you, I see these changes in your life, and I'm here to help with no judgment. And I might not be the person that's going to be providing the help to you, but if I'm a fellow student, right, let's go get a trusted adult involved. Or maybe if I'm your parent, let's get a professional involved who can help with, these signs that I'm seeing.
Wonderful. So recognize, be aware, and acknowledge.
You got it.
Thinking about parents, what are two, we always like to give parents essential tips here and educators, but let's start with our parents first. What are two essential tips for parents that you can provide in regards to the topic of suicide, or even supporting someone with, or a child or a friend or family member who's struggling with suicide?
So the first thing would be really learning those signs of suicide, right? What are we looking for? What kind of changes are we going to be noticing either in our own student or perhaps in somebody else? And then the second thing is, of course, getting that professional help in a timely manner, because the sooner that we get help, the more likely we are to have a greater impact.
Awesome. It sounds like once you recognize it, you can't waste time. You really have to act on it and move forward and be proactive.
That's it, exactly.
That's what I'm hearing. And then when we look at our educators and leaders in schools, and this can fall under educators who are in the classroom, counselors, anyone who works in a district or in a school environment, whether it is a parapro or anyone, what are two essential tips that you can provide to our people, our educators and our leaders and our people who support students in the school environment when addressing the topic of suicide prevention, intervention, and postvention?
So the first tip, and even a challenge, right, to our educator colleagues and friends would be just to try to become more comfortable with speaking about suicide. Again, I know that this is an uncomfortable topic, and for some individuals, still taboo. But if a student comes to you and shares that they're thinking about suicide, this might be the very first time that they have ever shared these thoughts with anyone. And you don't need to have solutions. You don't even need to know what to say. You can just listen. But you do need to be able to be a trusted adult who can be open-minded, make them feel comfortable, and get them to the right person in your building who can follow the appropriate protocols. So that would be my first tip and or challenge. The second tip for school staff is again to work together and see what would be an appropriate suicide prevention program that includes students, staff, and families. Research-based programs usually include all three groups because it is really critical for the whole community to have a common language, ways to recognize signs of suicide, and be able to support a suicide safer community for all of the groups collaboratively.
Awesome. So staff, families, and students all working together, prevention, intervention, and postvention. It really does take a village.
It does.
And then finally, for our listeners who may be interested in learning more or getting involved in suicide prevention efforts, what resources or next steps would you recommend a group that wants to? You mentioned the grant. We're talking about your book. So, of course, they can purchase the book. But what are some next steps or some resources you would recommend for someone who's trying to move forward, our listeners who want to get involved, want to learn more?
Oh, goodness. There are so many different amazing resources and organizations. Some of the ones that I really utilize, and again, are research-based. NAMI, that is NAMI, the Suicide Prevention Resource Center, the Center for Disease Control and Prevention, and the American Foundation for Suicide Prevention. Also, one of the ones that I personally work closely with is Living Works, and they have a variety of trainings for listeners who are interested in not only just getting resources, but if you wanted to be trained for suicide prevention, intervention, and postvention work.
Perfect. And we like to share our resources, and I know you mentioned quite a few. After we log off, I would love for you to email these to me, and I can add these websites and information in the summary on the YouTube page so families can go and research and gather the resources on the EdUfaith Essentials YouTube page. Would you mind doing that for us?
No, of course. I'm always glad to share. Yes.
Perfect. All right. So you have that book, which is Suicide Prevention, Intervention, and Postvention. We want to leave our listeners with how to get in contact with you and how to access your books. So you want to give us a little background and tell everyone how they can locate your books and your resources. And of course, I will have this on the EdUfaith Essentials YouTube page and on my website, on the EdUfaith Consulting website page. But I wanted you to just talk about your resources and where individuals and our listeners can contact you.
Thank you. I do work with NCYI, the National Center for Youth Issues. They're an amazing organization. And so I have a variety of topics that I speak on nationally. If you're interested in any of that information, you can go to the link that's provided here and see all of the different topics that I speak on. You can also see more information on the 3 books that I was able to share on with Dr. Cotton's podcast. The books are also available on Amazon, as Dr. Cotton has been so kind to note here as well. So I appreciate her willingness to share this information and the opportunity to be here today.
Thank you. I have enjoyed having you here, and you are a near dear friend and colleague, and the book is not only at Amazon. I just mentioned Amazon, but she has books everywhere. So go ahead and tell us where else we can find your wonderful books, because they are much needed in our society.
Oh, you're so sweet. I mean, you can get them directly from NCYI. That might be one of the easiest ways if you just use that link right there. But they are available in a variety of bookstores as well. So if you just Google them, you can easily find any of the various links for any of the books.
All right, listeners, that concludes part 1 of a 2-part episode of the EduFaith Essentials podcast, where we discuss suicide. Part 2 will be aired at a later date, and on those episodes, we will continue our discussion with Dr. Melissa Marsh as we discuss stress and burnout and her books related to stress and burnout. So stay tuned. There's more to come on the EduFaith Essentials podcast on a later episode. For our book excerpt today, I am not going to highlight any of my books. We're going to leave this focus on Dr. Marsh and all of her books. I just want to encourage you to purchase her books and my books as well. Those are all my books and resources. But today we're going to focus on Dr. Marsh's books and her topics for today's episode. I want to encourage you to subscribe at www.edufaithconsulting.com and subscribe to be a part of the EduFaith community. I also want to encourage you to subscribe to the EduFaith Essentials YouTube page so you can stay abreast all the information and the events and be a part of our community. Thank you for all that you do. Thank you for supporting me in this podcast. Subscribe and be a part of our community. I want to shift to our words of wisdom and our quote for today. And I also want to leave a few resources that align with today's episode. First off, the quote: when you feel like giving up, just remember the reason why you held on for so long. That quote is unknown. I want you to remember your why and to know that you are loved by someone, even if it's me on this podcast, Dr. Nakia. I also want to leave some additional resources and information aligned with today's episode. The first one is the suicide prevention. You can call or text 988. The next link is the National Depression Hotline, and that phone number is 866-629-4564. The next resource is the Suicide and Crisis Hotline, and that number is 1-800-273-TALK. And then the last number I want to provide is a text message. Text HOME, home, to 741-741. This information will be on the EduFaith Essentials YouTube page. And just remember that there are resources to help support anyone who's struggling with mental health.
You got me.
Now it's time for our essential advice, Ask Dr. Nakia, or share an inspirational story. I want to use this platform to support and spotlight fellow educators, families, and community members. If you have a question, want advice, or to share a wonderful inspirational story on this podcast, feel free to email me at edufaithforall@gmail.com. That is EDUFAITH, the number 4, ALL@gmail.com. Maybe it's your letter, provide advice, or share your story on this podcast. Disclaimer: all listeners should adhere to district policies, follow protocols, remain ethical, and adhere to guidelines in the best interest of children. EduFaith Essentials does not assume responsibility or is legally responsible for anyone's actions based on information provided on this podcast. I want to encourage you to get essential. Go to www.edufaithconsulting.com to see what EduFaith Educational Services has to offer. I have valuable resources, information, and a blog that you can subscribe to and find out more essential tips and resources. Go to www.edufaithconsulting.com and subscribe to the EduFaith Educational Services page. Get essential. This podcast is brought to you by EduFaith Educational Services. Some services offered through EduFaith Consulting include consulting and advocacy for parents, consulting for educators, leaders, and school districts, college accommodation advocacy, consulting and training, advocacy and supporting individuals with college accommodations at the post-secondary level, as well as university trainings to support individuals with disabilities and services, parent education trainings, college and career coaching for students who are entering the workforce or the post-secondary college setting, business and district professional development and trainings for churches, nonprofits, businesses, districts, and communities, specializing in services for diverse learners, including students with disabilities, interventions under the multi-tier system of support, English speakers of other languages, education and leadership coaching, program development under services under IDEA, Section 504, trainings, diverse learners, and essential tips books. Feel free to go to www.edufaithconsulting.com to view all the services that EduFaith Educational Services. I want to encourage my believers to be blessed. All others, be kind, be well, and be the change. Follow EduFaith on social media. Twitter, EduFaithS. On Instagram, EduFaith 2021. On LinkedIn, EduFaith Educational Services. Thank you for listening. Thank you for supporting EduFaith Educational Services and the EduFaith Essentials podcast. Subscribe and follow EduFaith Essentials on the EduFaith Essentials YouTube page, and listen to the EduFaith Essentials podcast on all streaming platforms. Thank you for listening. Thank you for your support. Have a wonderful day and get essential.